Hello, everybody, and welcome to the Tuesday edition of Video Clips, which is brought to you by Wellness Forum Health, the Wellness Forum Institute, and Make Americans Free Again. So the first thing I want to tell you is that our cancer summit last weekend was amazing. There was so much great information. All of the speakers were fantastic. We all learned a lot. The guest speakers were awesome. The cancer patients who shared their stories were super inspirational. So I think people who attended definitely learned two things: that patients who are intent on survival do better. Mental attitude has everything to do with it. And that there are many, many choices for treatment that most people don't find out about. So you can purchase access to the recordings for the summit if you missed it and wish now that you hadn't, or of course, if you had already excuse me, paid for the summit, Kelly will have sent you the recordings by the time this video airs. Also remember that 4 programs like this per year are included in annual pass membership. I also still have the Empower Yourself recordings from last week. That was free, and you're welcome to ask for the recordings to those as well. This workshop covered research skills, green tea and cancer, and why it's so difficult to lose weight. One more thing, and then we'll get into the topic, which is cancer, surviving cancer. I wanted to focus on that a little bit today. The annual Food Over Medicine retreat is May 2nd and 3rd, and there's some things we're going to cover I know you want to know about. One is the great protein debate. Too much protein, not enough protein. People are all over the map on this. I'm going to show you what the evidence shows. We're going to cover omega-3 fatty acids, vitamin C, magnesium, irritable bowel, gluten, glyphosate, inflammation, SIBO, and more, lots more. And I'm going to do, first time, I'm going to do a virtual cooking class with some recipes from my cookbooks. I don't know if you guys know that. I wrote 3 cookbooks back in the day. So some new recipes that you haven't had before. And you do check it out online at wellnessforumhealth.com. There's a complete description on our calendar. And a bonus session on the Sunday. So it's a Friday, Saturday, and then Sunday, a bonus session. We're going to help you make a plan so that you will put into action everything that you learn. All righty. So here's what I want to talk about. The one thing that was crystal clear during the Cancer Summit is the importance of extended survival. It is the metric that matters. Over the years, we have created a huge body of resources for cancer patients and developed a program to help them make informed decisions about treatment. It's important to evaluate all options offered, because particularly those by conventional oncologists. And let me say this, I think most doctors are well-intentioned, but here's the problem. You can be the most well-intentioned oncologist in the world, but there's a big disconnect between what patients are looking for and what conventional oncology offers, actually ends up delivering. What patients want is longer survival. They also are very concerned about quality of life, but this is not always what the treatments deliver. In fact, oncologists will often explain the benefits of treatment in terms that sound really good, but avoid that $64,000 question that is the real thing cancer patients want to know. How long am I going to live? So let's talk about the confusion. So one is surrogate markers are defined as measurements that are substitutes for clinically meaningful endpoints like lifespan, but they are commonly used instead of that discussion, lifespan. So in oncology, the surrogate markers include shrinking tumors, improved blood tests, and terms like progression-free survival. And none of those things may be, and often are not, related to survival. So let's start with some definitions. The metric that works, as I said before, or that matters, is the way I should have said it, is the average length of time patients are alive after the start of treatment. That's what they're interested in. How long am I going to live? Progression-free survival is the average length of time after the start of treatment when the patient is alive and declared cancer-free, until the cancer returns and starts growing again. And then response rate is the percentage of patients whose cancer shrinks or disappears after treatment. And that can be wonderful. That's news everybody likes to hear, but it doesn't necessarily mean that you're going to live a single day longer. All right, so where did these terms even originate? They were originally developed as technical terms to signify whether a therapy in a phase 2 clinical trial was promising enough to justify phase 3 trials. They were never intended to be the basis for clinical practice or for a patient to choose treatment. Unfortunately, despite this, surrogate markers are generally the way treatment benefits are explained to cancer patients. So, if you look at studies, and I've looked at hundreds of them, the correlation between one of these surrogate markers, a shrinking tumor, a better blood test, and overall survival is very weak. In fact, in many cases, patients would choose different options if they knew it, or at the very least, seek adjuvant treatments to complement their conventional therapy. We found out about a whole lot of those, particularly from the patient panel last weekend. So, it was just very interesting that an article appeared on Medscape about this very issue, and I decided to cover it since we just had this cancer weekend. But the conventional view, as this article says, in the oncology field is that overall survival, how long you're going to live, is not a feasible endpoint for clinical trials. So the authors of the article, I found this super fascinating. One was a college professor and medical doctor, and the other a cancer survivor and patient advocate, disagree with this. And what they did was they listed the argument against paying attention to overall survival and then their response to it. And I don't think I could have said it any better, so I'm just going to tell you I've summarized it all so it could be short. But anyway, one argument is that response rates and progression-free survival are important clinical endpoints because patients feel good when their tumor shrinks or when they have time when the disease isn't getting worse. So these improve the quality of life for the patient. And the authors of this article on Medscape respond, this might be true. A patient's always happy to hear that a tumor has been reduced in size. But the positive feelings are based on a belief that these improvements are a sign that recovery is taking place, and this might not actually be true. Additionally, a patient experiencing a response rate or progression-free survival may have had devastating side effects and maybe would not have signed up for the treatment and endured those side effects if it was known that the drug treatment would not, extend life at all. And then another factor that never gets talked about is how much this all costs. Cancer treatments are super expensive. They can cost hundreds of thousands of dollars, and they're often not covered entirely by insurance. In fact, I spend a lot more time talking to people about what their insurance will cover or not. And then I'd like to, because optimally, cancer patients would just choose the best option for treatment. Well, here's another argument that conventional oncology makes. It's not ethical to wait for overall survival when there's an unmet need. Well, the authors respond that this isn't appropriate. The unmet need is for a drug that delivers clinically significant results, not a treatment choice that provides the illusion of clinically significant outcomes. It's unethical, yet it goes on in healthcare every day. And by the way, it's not just in oncology, just the stakes are higher in oncology. Another argument, overall survival is not a practical endpoint for drug trials for rare cancers. Well, the authors acknowledge some validity to the claim, but I have some caveats to this. I've created videos and written articles about the fact that drugs, including cancer drugs, are often approved based on a promising single trial or a limited trial data, with the caveat that the FDA requires follow-up trials to prove efficacy. Well, I've written about this a lot. I've posted videos about it. The FDA often doesn't follow up. Many, if not most of the drugs that are approved with these conditions, the follow-up trials are never performed. The FDA doesn't do anything about it. The FDA should revoke approval on the basis of not providing the follow-up trials, but it doesn't do it, which is why the behavior continues. An argument by conventional oncology. I think this is perhaps one of the most bizarre arguments made in favor of the way cancer drugs are approved. And it is the point of measuring overall survival is to ensure that the treatment doesn't worsen overall survival. In other words, it's great as long as it doesn't kill you sooner. I mean, I don't even know what to say about that, but the authors argue that not worsening survival is contrary to what should be medicine's fundamental goals. All drugs have toxicities, some of which can be fatal. recommending a treatment with toxicities because it doesn't make your lifespan worse would harm patients and go against the Hippocratic Oath. And I guess my side comment to that is that we have seen in the last few years degeneration in medicine to the place where I'm pretty sure doctors aren't thinking much about, many of them are not thinking much about the Hippocratic Oath at all when they're helping patients. Um, Again, one that just is bizarre. Overall survival in a trial can be negative, but could be a false negative finding, and future trials might be positive, so we should go on ahead and approve the drug. And this often happens, and how they justify it. And I'm going to respond to this one because I have a lot of information about it. The way that they do this is to use subgroup analysis. This means finding a group within the trial population for whom the drug did show some positive benefit. So if cancer patients who have red hair and live east of the Mississippi and are right-handed seem to benefit, then we go on ahead and approve it pending further research. This is ridiculous, but if these are the rules, the cancer patients should at least be made aware of these rules, and it might make them not so interested in what's offered after these statements, right? And this is what we do at Wellness Forum, by the way, and what we consistently find when we look at these subset analyses is that most people aren't like the subset, so the drug would be worthless, expensive and toxic, but worthless, and that's not acceptable. And then the last argument, while some trials result in negative overall survival, once clinical practice guidelines recommend using them, then you should follow the guidelines because we're all sheep and medicine is populated with sheep and they should just follow directions. The guidelines should dictate care. Those are my comments, obviously, but it's hard not to make snarky comments about stupidity like this. So the authors rightly respond that guidelines should be based on evidence, but they add that one of the impediments to this and why some of these ridiculous drugs with no benefit, sometimes more harm than benefit, get approved is because members of committees that establish the guidelines are often conflicted and show bias. And I've written about this and made videos about this for a very, very, very long time. There are articles in the Health Briefs Library, the members library, that talk about very specific drugs that never should have been approved for any purpose. They should have died on the vine and never seen the light of day, but were approved because or became part of the standard of care because of conflicts. So there are a few bottom line points I want to make to summarize all of this. First, I want to reemphasize the metric that matters most to cancer patients is survival. How long am I going to live? And I think that we all would, if we put ourselves in the place of a cancer patient, that's what we would be interested in, right? Second, truth in medicine has gone by the wayside. It's been gone for a very long time. When businesses in any other industry engage in deceptive practices like what I've just described, the state attorney general or consumer lawsuits are filed and the business is forced to change its ways and sometimes close due to unethical practices. One of the things Wellness Forum's nonprofit organization, the Wellness Forum Foundation, is going to be doing in future years is suing people, suing medical institutions and physicians who do not make the right disclosures to patients. I hear every day from people, if I'd known then what I know now, I never would have, and then you can fill in the blank, whatever it was that the person would never have done if they'd known the truth about it. Third, all patients should be properly informed before starting any treatment outside of emergency care, particularly true for cancer patients because the risks associated with making a wrong choice can be fatal, can include fatality. The consequences are much more dire. And by the way, this is what we do at Wellness Forum, which is why you might want to consider becoming a member. Our members, particularly our long-term members, often know how to figure out things much better than some of their doctors do. And my whole motto from the beginning is patients in charge of their health, patients in charge. And this is the way we are in all other consumer interactions. We don't outsource our decisions to other people when we buy houses and cars and retirement accounts. Why should we be doing it in a healthcare setting? New Cancer Concierge members will have access to last week's Cancer Summit. You can still, if you're not one of our cancer members, you can purchase access to it yourself. And remember, if you join now, you get a gift certificate for the dues that you pay, which you can apply to other Wellness Forum programs. Just two last things before I sign off. Virtual yoga with Pam starts April 9th, and that's for group classes, one private lesson, and access to a platform that provides dialogue, instructional videos, etc. And I just completed a new schedule for health professionals who are starting to train with us spring, summer. So if you want some updates on that, send me an email at pampopper@msn.com, and I will send information to you. All right, well, that's all for today. As usual, pass this on to anybody who you think would enjoy watching it, and I will be back to you on Thursday with more news. Thank you so much for watching.